Hello friends, today we'll discuss a special category of red chemical peels that are named as RIPs. So what are RIPs? These are a group of 6 peels. As you can see the photos over here, these are 6 peels, and this is designed for trained and experienced cosmetologists, dermatologists or aestheticians which know what chemical reagents, how they act. Those are used in the chemical piece. How to play with that, how to control on the chemical peeling procedures. So these are these are designed for various skin concerns with precision and safety. So they are safe, but only if you understand the chemicals. If you are not experienced and not that much aware of the properties of those chemicals used in the chemical piece, don't try. And this is only for the experienced people who are trained professionals and not for general home use. So we'll see one by one what these peels are. See first the names. First is RI peel basic. So RI peel basic is the lowest concentration in these, and this is for first time users. Means first time who are using the RI peels, and not for those who are who have never used the chemical peels. So these you are well versed with the chemical peeling procedure and you want to try in a client who is doing the peels for the first time, then you can use these peels. And for sensitive skins, so if the skin is sensitive, this is the basic formulation of RI peel. You can use, the strength is minimum and therefore you can safely use it. Then the second one is RI peel fort. Fort means fortified. So it has concentration of chemicals higher than the basic and has an enhanced strength, and it is used mostly in the mature skin for deeper concerns. So deep seated melasma or displaced hyperpigmentation or acne, for whatever cause you are using the chemical peel, you can use it, especially for mature skin. The mature skin, then it involves wrinkles and aging signs in the skin, so there you can use. Now the third one is RI super. Super, it is for pigmentation. It is as it has brightening agent. So if you have if you want to treat someone with hyperpigmentation or patches, that will include melasma also, so you can use this RI peel super. Now the next one is super purge. Before that we'll see the purge one. It has acne solutions. It is an acne solution for oily congested skin. So if there is too much of acne, you want to treat acne, you can use purge. And if you want, if there is both acne with the pigmentation, then you can use super purge. So it has properties of both the super purge, super and the purge. So therefore the name super purge. And the last one in this list is the body peel. So you understand the hyperpigmentations on the body or the thickening of the skin, very fine, knees, ankles, knuckles, and various area other than the face. In general chemical peelings, body means the area of the body other than the face is considered as body. So wherever other than the face you want to use, you can use. You are not supposed to use it in the intimate areas or the very sensitive areas. There are different peels for that. So now we will first see the basic. So this is orange. So this is how the bottle will look like. It's 30 ml bottle and comes with the neutralizer. So this is all true for the all standard peels except the lemon peels of Rexall that they come with the neutralizer. So a 30 ml bottle of chemical peel RI basic with the neutralizer will come. So as we have seen, for the skins which are new to chemical peelings, however, they are sensitive skin, and the clients which have never done the chemical peeling, you don't know what how the skin is reacting in this person, then you can use RI basic peel. It is a medium depth peel which will penetrate both epidermis and the upper dermis, and the application time is 1 to 3 minutes. Now most of the peels of Rexall have the application time 1 to 3 minutes, except for higher strands of TC and all where you have to judge. There is no specific protocol that can be given for any given peel, because everyone's skin has a different level of sensitivity, but still we have given a range. This can be increased and decreased depending upon the requirement. So this is something normal type. So you can, the requirement may be 30 seconds also, or it may be 4 or 5 minutes also. You have to judge it according to the, while doing the procedure. So how the skin is reacting or the previous experience of the client. So accordingly you have to adjust the time. Now the cost of the peel is, the MRP is 2600 rupees, but the Rexall is giving, if you purchase directly, at 1300 rupees. Now we have seen the bottle of the basic RI basic peel. Now we'll see the contents. What are the contents? So it has TCA 12%, salicylic 12%, phenol 12%, retinoic acid, and vitamin C 4%. So TCA is in good strength, salicylic acid is also in good strength, phenol, retinoic acid, and vitamin C. So we see, even if it is a basic peel for sensitive skin, but it has good strengths of acid. So among the RI peels, this is a lower strength peel. But if you compare with it with the other peels like Glycolic 50 and all, this has a good strength. It has good strength of all these agents. Now, specially, I would like to tell you about retinoic acid. So it is not retinol. So you get yellow peels and all with the retinol 20% and all. This is not retinol. This is retinoic acid. It is a most potent variant of retinol, vitamin A. It's called retinoid, and it is in 0.3 strength. This strength is uh, high as compared to those retinol 20% peels and all. The strength will be higher, the peeling will be more than those. So don't consider this 0.3% as less. It is a good strength, and vitamin C is there 4%. So these are the ingredients of the RI peel, basic peel. Now what are the benefits of this RI basic peel? Now it will improve the skin tone and texture. Early signs of aging, you can reverse it. It will give you a clarity of skin. So if you have dull patches and all, it will improve that. It is good for the first time users, and it is suitable for sensitive skin. So these are the benefits of, these 5 are the benefits of RI Peel Basic. So now we have covered. So to summarize, RI Peel Basic is the peel for the first time users, first time who are undergoing the peel, not for the first time, not the first time doing cosmetology. You have to be experienced while doing this peel also. You have to see what is going on while doing the peel. Is there redness, is there frosting, is there, or whatever is there, you have to judge and do the peel accordingly. Now we'll see the second one, that is RI peel fold. So the bottle is the same, 30 ml bottle of peel and 100 ml bottle of neutralizer. So these two are the same, and the concentrations of the chemicals that will be different. So what is RI peel fold? It is an enhanced strength peel over the basic. So you have seen the basic. Over that, it has more enhanced acid contents. It is designed basically for mature skin, 40 plus, with a deep wrinkles, fine lines, loss of elasticity. So it will be giving anti-aging benefits and maintaining the safety profile of the basic peel. So it has the safety profile of basic peels also, but it has more acid content, and you have to take care and everything similar to the basic peel. So what is the enhancement? It is 20% stronger than the basic peel for more intensive results. And here, as we see, it is used in the mature skin, so the skin is less sensitive and is more tougher to peel. So therefore, this RI peel fort is used. So the target audience that we have seen is 40 plus, male or female, with deep wrinkles, fine lines, and loss of elasticity. So this is the target audience, but the skin should not be sensitive. If you have the history of the person, okay, the skin is sensitive, don't do that. Don't do this peel. Or if you don't know anything, try one session of any peel other than RI peel, like glycolic 50, 70. So just to get an idea of how the sensitivity of the skin is, how it reacts. Do a mild peel like TCA 15 or SAR 25. 25 is not a milder, but you can try to see the results and then go for this RIP. So the cost is the MRP is 3000 rupees and you get it at 1500 if you buy directly from Redsol, from its website or the WhatsApp number. So this is the packing we have seen. So now we'll see what is the addition in this. So there it was TCA 12%, here it is 15%, salicylic is also 15. So these three which were 12% in the basic, here it has become 15%. Then tretinoin was 0.3%, here it is 0.5%. Vitamin C was 4%, here it is 6%. These two are addition. Now what is allantoin? Allantoin is a soothing agent because the concentration of acid is there higher than, so we have added over here allantoin. Allantoin is a soothing agent, so the burning and all the sensation what is going to happen during the peeling procedure will reduce a bit. And aloe vera moisturizing agent, this will also give you a soothing effect while doing the peeling. So what is the difference? It has all the same core ingredients of the basic formula, but increased concentrations for more intensive anti-aging benefits. So you want to do peeling in aged skin, where the skin you feel is tough, that is tough melasma or something, then you can use this peel. Now the another peel we'll see is RI peel super. So the first one was basic, second one was targeted for mature skin. Here the target is pigmentation. So wherever you want to achieve whitening, you can use this peel. So what is the difference? To the basic formula, hydroquinone and kojic acid is added. Hydroquinone, as you know, is a whitening agent, is added in this, and the kojic acid also contains hydrocortisone. Now hydrocortisone, as you know, is a steroid to reduce the PIH that may occur after doing peel, or any peel if you do, the PIH may occur. So here we have hydrocortisone that will reduce the inflammation during the healing process. So inflammation at the time of peeling will not occur that much. So the pH will also not come in, and or the chances of pH will reduce. Not that pH is can be seen anytime during your practice if you are not knowing the chemical the skin of the patient. So whenever you try stronger peels over some patient, you have to have the basic idea how the client's skin is, and the client should also not keep shifting their cosmetologist or dermatologist to someone new who doesn't understand your skin. So explain this to your clients. Okay, you should not keep jumping from one cosmetologist to another if you are not getting results. So it may be in a trial phase or something like that. So you have to stick to your cosmetologist before taking a decision of shifting to some other cosmetology. So where this peel is used, it is used in UV induced pigmentation. So sun damage or any ultraviolet, even the mobile radiations and all, this also give UV radiation. So pigmentation can occur there also. And you can use in sunspots, and through our powerful brightening agent, the cetan. It can be used in melasma, stubborn melasmas, because it has tyrosinase inhibitors in this. So for stubborn and melasma, can use. For achieving even tone, if there are patches over the skin, you can use it. Try to do peeling in that area where there is hyperpigmentation first, so that the contrast between the normal skin and the hyperpigmented skin reduces first. So you have to correct the contrast, and then you can in subsequent sessions you can. So in all these peels, the time is 1 to 3 minutes only, whatever the entire range of RIP, but you have to do the peeling and keep the peeling for the time depending upon what results you are seeing on the client's skin. At the time of how much discomfort is there, redness is there, inflammation is there, pain is there. So accordingly, you have to adjust the timings. Okay. Now we'll see the ingredients of the super. So here, as the TCA, salicylic and phenol, these are 15% only. This is the same, this is the same. Now what we have added here is hydroquinone, kojic acid, hydrocortisone, allantoin, and aloe vera was there also. So upon the fold, what the addition is hydroquinone, kojic acid, and hydrocortisone. Hydroquinone is a whitening agent, kojic acid is also a whitening agent, and hydrocortisone is a steroid to reduce the inflammation that I told you. So this is the ingredient list of RIPL Super. Similarly comes with the 30 ml pack with 100 ml neutralizer. And the cost, If you buy from Red Soil, it is 1700 rupees. And it is used for stubborn pigmentations, melasma, sun damage, as it has all the powerful brightening agents. Okay, now we'll see one more next peel, that is purge. RI peel purge. It is for acne. So what makes it qualified to use for acne is benzoyl peroxide. Benzoyl peroxide is 10% and hydrocortisone, it was there earlier also. It is same steroid for preventing PH. It is special target for acne prone skin. Ideal for active breakouts. You can do it in active breakouts also for oily change skin and teen acne. So what will it do? It will kill acne causing bacteria. The benzoyl peroxide will kill all the bacteria, especially the P. acnes bacteria. It unclogs the pores, remove the clogging of the pores, will dissolve any secretions that have that are blocking your pores. So the secretions flow out and the acne don't occur. It will reduce the inflammation by as there is hydrocortisone, and it will control the sebum secretion for giving you clearance by salicylic acid is there, which is good for oil secretion control. Now what are the ingredients? This is same as that was in the fort. 15% TCS, salicylic phenol, retinol was there, this was there. Now the addition here is benzoyl peroxide for acne. Rest, this is we have seen in the earlier also. So for the acne, we have added here benzoyl peroxide. This is the main point in this. And the cost is 1600. If you buy from Red Soil, actually the MRP is 3200. So this is a comprehensive acne treatment combining antibacterial, anti-inflammatory and pore clearing benefits of a powerful formula. Okay, so now we will see the next peel. The next peel is Super Purge. 30 ml bottle of peel again. So as the name suggests, it is super and it is also purge. That's why the name Super Purge. It will combine the benefits of purge and super formulation in one powerful solution. It addresses both active acne and post-inflammatory hyperpigmentation simultaneously. So what you see here is it has benefits of super. The super we were using for pigmentation, and purge we use for acne. So if there is something that has hyperpigmentation, you want to treat hyperpigmentation also, and you want to treat the acne also, then you can use super purge. So super purge is where combination treatment is you have. So what it will be having? It will be having all. This is acne thing. Benzoyl peroxide, hydroquinone for whitening, kojic acid for whitening, and hydrocortisone for reducing the inflammation. And it will be ideal for whom? Who are struggling with hormonal acne and the dark spot they leave behind. So the acne is now gone, and or somewhere the acne are there, somewhere they have left the hyperpigmentation, and so the combined thing is there. You can use this peel. The cost is 1800 if it's from Red Soil, and This is the 30 ml bottle that it comes. So where it is used for active acne treatment, it will kill the bacteria, reduce the inflammation with benzoyl peroxide and hydrocortisone. For whitening and pH, it has hydroquinone and kojic acid. And the basic other things of the TCNM, everything is there. So now we'll see the next peel. So the last one is body. So this is body peel for the body. Can use it for body acne also, and scars, marks, stretch marks, sun damage. So any issue over the body, if you want to go for a good peel, stronger one, then you can use it. It is formulated for thicker skin on the body. For the concerns like acne, scars, stretch marks, sun damage, and on the areas of the chest, arms, back, everywhere. So what it has? It has TCA 12%, glycolic acid, lactic acid, mandelic acid, salicylic acid, and phenol. So it is quite a strong peel because there are 6 peeling agents in all this. So even if the strength of each of this is medium, it is not, these are not very light peeling agents, medium strength peel, but together all of them are incorporated in one peel. So the actual peeling strength will be high. Now the soothing agents in this are the allantoin and aloe vera. So allantoin, and to reduce the discomfort, the cost is 1400 rupees, 1450 rupees if you buy from Red Soul. So now we have seen the 6 products of RI category of Red Soul. Now we will see how the peeling is done. So what will happen after the peeling is applied? There will be 4 to 6 hours. There will be tingling. There will be some amount of tingling sensation. Maybe it is normal. So you keep the peel for 1 to 3 minutes. You wash it out, but still the effect continues. So there is, since the agents have penetrated the skin, they keep on acting for 4 to 6 hours. So now first 4 to 6 hours you might feel some tingling sensation. Then one to do this, the skin will be tight, appear darker. So or it may appear red. So you have to explain to the client that the skin will become dark or may appear red. So and so after 24 hours, begin with mild, gentle cleansing and moisturizer. So what we generally recommend is a mild soap like Pears or Dove after 24 hours. Harsh chemical should not be used because your skin is being peeled off, and now what is happening is whatever chemicals or something you apply, that will easily penetrate in your skin and it will damage, and then with pH will occur. So you have to avoid everything. Sunscreen you have to start applying from the next 24 hours only. So day 2 or 3, what will be happening? Peeling will generally occur around the mouth, chin, and spreading because there is too much of activity around the mouth. The skin keeps on, because we are talking, eating, everything. So that generally the peeling starts at around the mouth if you are applied the face. and it is, the peeling is generally light and sheet like. But everything happens if you have done the procedure properly. Then the sheet like peeling occurs. Now avoid picking. So this is the most dangerous mistake that client does. Okay, removing the skin by its own hand. So once the skin below the skin which is being peeled heals up, the outer layer should shred out. But people don't wait till that time and they just remove the peeling skin. So what happens? They are exposing the new skin which is not prepared for the environment, and then what will happen? The blackening spots will occur in those areas. It will turn dark. So we have to explain to the client that the time that will take for the peeling, you have to don't have to interfere in that. You have to wait until the skin sheds off by itself. Pulling will cause scarring and hyperpigmentation. If you pull off the skin, it will definitely cause scarring and hyperpigmentation, depending upon how prematurely you have pulled it out. So generally on 6 to 7th day, you will see fresh, rejuvenated skin underneath that comes. If you have gone too deep, this 6 to 7 days time may increase. It may go up to 10 to 15 days also. But generally, this is normal. Everything you have done the peel properly, you have not gone deep, you have neutralized in a proper time, then it happens in 6th or 7th day. So now what are the post-treatment care in this RIP? So this is generally for all the chemical peels. We'll see what the post-peel instructions are there. This will help to prevent the complications. First is sunscreen. SPF 30 is recommended, but you better to go for SPF 50 also. And if you're going out especially, then use SPF 50 plus, and if you are in the home, use SPF 30. So even if you are not going outside, you have to apply sunscreen. Gentle soap or cleanser. So generally cleansers, if you are using very mild cleansers, then it's okay, or soap is good. You know what you are using. So generally Pears or Dove soap is good. They are mild, or the baby soaps you can use for cleaning. After 24 hours, you can start using soap. Hydration by moisturizers, and this will help in preventive excessive dryness because the skin is now dead, so it tends to become dry. So activity restrictions. So strenuous activity should not be like gymming, too much of running, marathon running, or those things you should not have, because there is now the gap between the skin which is peeling and the new skin. A space occurs, because then what happens is the sweat by strenuous activity is avoided, because the sweat that is coming from below starts getting accumulated between these two areas, these two layers of the skin. One which is which is being burnt out by the chemical peel, and the lower which is the new skin. So you will start seeing boils if you're doing too much of strenuous activity and there is too much of sweating. So along with the activities, hot showers also you are not supposed to take. Sauna you are not supposed to do. The swimming pool activities you are not supposed to do while the healing process is going on. So generally 15 days, 20 days till everything you see all the events have occurred and the skin has peeled off and everything has happened, you have to avoid these activities. So explain these things to the client so that they can plan whether to do the peeling or not to peeling, and their activities, if they are regularly going for gyms and all and they cannot avoid that, and then after doing the peel you tell them from tomorrow you don't go to gym, so then that becomes a problem. So before doing any procedure, what post care they have to take, you have to explain to the client. So how the treatment is done. So every treatment is in 4 to 6 weeks apart. In Indian skins, you can do it in 3 to 4 weeks also. If everything is non and healing of the previous session has completely occurred in first week only, you can do it in 3 to 4 weeks. So 1 month interval is good enough. So follow for the maintenance treatments. Maintenance. So once you have done 3 to 4 sessions or whatever sessions you have planned, you have got the desired result. Leaving each session after 4 to 6 weeks, then maintenance of a few months after, like 3 months or 6 months, you do one session. So you maintain the results what you have achieved with the first treatment. So understand which formula of the RIP you are going to use, why you are using it, understand the ingredients, and then only choose the pill. And there should be a customer treatment plan if required. What treatments along with these you are giving, you're not. So is the client going for hydrofacials and this and that, so try to make them customize. So we'll summarize all the P's in this chart. RI peel for first time users, as TCS salicylic, it is used for improved texture and tone. Fourth, for mature skin, there is enhanced concentration of the basics and used for wrinkles and fine lines. Super has addition of hydroquinone and kojic acid. This is for hyperpigmentation. For pigmentation. Purge is for active acne, has benzoyl peroxide, clear oil control skin. You will get. It is a super purge is a combined formula of super and the purge. So it has all this and will achieve all this and it is used for all this. Okay, so acne and PIZ is used. It's a combined formula. You will get clear skin, and the acne and all will go, and you will achieve whitening. And as the name suggests, body peel. It has multiple acid blend. There are total 6 acids in this, which are used in peeling. It will improve the body skin tone and for use for body concern. So this is the entire summary of the RIPs. If you want to purchase, I'll write down the number. This is 977-3494-509. It is a WhatsApp number. You WhatsApp me on this, give your address, the products will come cash on delivery at your address. And if you have any queries or you want to see a brochure in the PDF form of RIPs, then you can also WhatsApp. Just type a message, send brochure of RIPs, we'll send it. If you want to see other products of Redsol, other peels, and because Redsol has around 80-85 peels now. So there is a wide range of peels available with Redsol. So you can get the brochure of all the products also. So you can. So now there should be, what are the application standards that should be maintained? It should be done by trained skin professional only. It is not for home use. If you don't understand chemicals, you don't understand chemical peeling, please don't try. Getting trained from YouTube videos is good to hear, but it is not practical. There are many complications, many problems associated with chemical peeling that you face after you apply the acid. And once applied, it cannot be reversed. So you do the damage, then the damage is permanent most of the times. So don't try chemical peels, any chemical peel, not only the RI peels, any chemical peel. Don't try until you have perfect knowledge of that thing. And why are you doing it? You are doing it to look beautiful. You might damage the whatever existing skin or beauty you have. So don't damage. So go for a trained professional only for doing, and it should be done in clinical settings only. There should be thorough skin assessment before doing a peel. Thorough skin evaluation. What is the usual history, the medical history. So if the acne are too much, and so even if you treat this acne, it won't benefit. So medical history, treating the underlying cause of melasma or hormonal imbalance, whatever is there, you have to know that before doing. So for that medical history, taking medical history is very crucial. Customized approach, depending upon the type of skin, concerns, tolerance levels. Customizing the time, even the time you have to customize. So how much time to keep that you have to customize, and it differs. So no company can give you the fixed time. This is the peel and this is the time you have to keep, and it is okay for everyone. So no, it is not like that. So what are the safety and contraindications that you have to look for? So pregnancy, breastfeeding women, you don't do any cosmetic procedure. Similarly, you don't do RA chemo pills. So if there are open wounds, so there is an ulcer or something like that, non-healing ulcer is there, something like that, or is there injury is there, acne you can do. It is not considered other than any fungal infection or something like that. Other than acne, so you don't do. Simply, if the deep seated infection is there in the skin, don't do chemical peel. Recent sun exposure or sunburn. So if the sun exposure is recent, so I have been to Goa and I have come back from Goa, and the second you start doing peel, let the effect settle down of the sun damage. Let the effect settle down. Then, if there is history of keloid scarring, this is a dangerous thing. So that is why the medical history. So if there is a keloidal tendency, even a slight cut marks or something, a keloid develops, and you are now doing injury by the chemical agents. Keloids might occur. So if there is history of keloid, don't do any penetrating aesthetic procedures, especially chemical peel, dermal, and you have to avoid. If there is current use of any certain medications which will affect, like people are taking some oral retinols and something like that, that will increase the sensitivity of skin. So you don't know what is going on. So that will be difficult. So stop all the medications which are not essential. You can stop it or something like that. That may cause interference in the cosmetic treatment. You have to stop these medications. So, and there should be no unrealistic expectations. So if you explain the expectations, what are the client expectations? This is very important in cosmetic practice. You have to understand what the client is of the client. You have to see. Now, what are the pre-treatment requirements of uh, doing this? First thing is patch test is recommended. Discontinue any retinoid vitamin A derivatives that the client is taking prior to the treatment. Avoid sun exposure 2 weeks before. So any sun exposure means he is not going to some vacation or something like that to hot climates. Um, Tell him to use sunscreens 2 weeks prior. This may not be practical in all times, but try to achieve this. A complete medical questionnaire. So you should know what you are doing. For that, a complete medical questionnaire is required. Post care requirements you have to explain and understand and tell the client. Okay, these are the post care requirements. Can you take this post care? If you can take this post care, then only, and realistic timeline expectations. So what you are going to expect after that. Okay, so this you have to explain. So expected results in the timeline is 0 to 7 days. Peeling will occur. There will be temporary redness for some time. Skin renewal becomes 1 to 4 weeks. There is improved in the texture. Initial tone improvement is there. A reduction in the fine lines you will see. In 1 to 3 months, there will be pigmentation reduction, enhanced clarity, continued improvement from the first one. And the long term, if you do proper follow-up treatments, the results can be maintained. So you have to maintain the results by doing the next sessions, the maintenance sessions. So this is all. Now if you want to purchase any of these products, you can WhatsApp me on this number. There are two websites, redsol.com and redsol.in. You can purchase it from there also. Not only these products, all the products of Redsol. Okay. So now why do you choose the RIPL solution over the other pills? It is a very scientifically researched formula with basic ingredients that are good, known to be good peeling agents. These agents are all tested under FDA rules and the quality control is very strict. The safety protocols, we have explained everything. These are all professional strength peels. Okay, so you have to be careful while using it while selecting the peels. And these are customized solution for, so we have solution for acne, we have solution for pigmentation, we have solution for body, we have solution for basic sensitive skin. So these are customized solutions, so you can use it. The results are proven and visible improvement is seen while doing the trials. So this was all about the chemical peels, these 6 P's which I've told you earlier. The RI chemical range, RIP's range of Redsol. If you have any doubts, WhatsApp me on the number given, and keep watching our channel. Please like and subscribe so that if you can get notifications of whatever the new videos or product information we are giving, that will benefit your aesthetic practice also. Okay, thank you very much.